Hi everyone, in this video I'll be discussing glycopeptides. So we know that certain drugs act on cell wall, and glycopeptide is one more group of drug which act on the cell wall. Now let me tell you, glycopeptides inhibit an enzyme called transglycosylase. So they inhibit an enzyme called transglycosylase that has been asked repeatedly in your exam. Please mark it. What are the mechanism of action of these drugs? So by inhibiting this enzyme, they inhibit the cell wall synthesis. They inhibit cell wall synthesis, and these drugs are bactericidal drugs. So glycopeptides are bactericidal drugs. Now, whenever we think of glycopeptides, we think of the spectrum of activity. So spectrum means what bacteria do they cover? Remember, they cover only gram positive only. Very, very important. They cover gram positive only. Their name is glycopeptide. In glycopeptide, the major drug you all have to remember, let me write glycopeptide as GPs. It is the vancomycin. The name is vancomycin. Remember, these glycopeptides are very big in size. So if I give that orally, it is not absorbed. Please remember pharmacokinetics. These are not absorbed orally. So you cannot give this drug oral. Why? Because they are not absorbed. Second important, when you give them IV, intravenous, vancomycin, it releases histamine. Vancomycin releases histamine. So you know the reactions of histamine. So patient will become red, itching, oral thing. So patient will develop a syndrome called red man syndrome. Patient will have the red man syndrome. Again, a potential question for you. What drug causes red man syndrome? Sir, how to avoid this? Can we avoid this? Yes, you can avoid. How? Before giving vancomycin, you have to give prior antihistamine should be given. So we have to give them prior to administration. Second, give slow IV. So these are the things what can prevent red man syndrome. That is the pharmacokinetics not absorbed orally. Now, another important aspect you need to understand the spectrum. I told you, spectrum is vancomycin acts on gram positive only. The meaning is it doesn't work on gram negative. That's the meaning. Will it work on pseudomonas? Will it work on pseudomonas? Yes or no? Pause the video and try to answer this question. Your answer is correct. It will not work on pseudomonas. No. The reason is pseudomonas is gram negative, and many a time this question has appeared in your exam. Will vancomycin work on pseudomonas? No. Then where do you use this? What are the use of vancomycin? It is the drug of choice for MRSA. MRSA stands for methicillin resistant staph aureus. There it is drug of choice. Second, it is also used as a drug of choice for Enterococcus faecium. So Enterococcus faecium, it's a drug of choice. Now it is also used in the treatment of PMC. PMC means pseudomembranous colitis. Let me write the full form. Pseudomembranous colitis. Okay, so nowadays the guidelines are telling that the first choice for pseudomembranous colitis is oral fidaxomicin. If that is not in the option, you can choose vancomycin as your answer. But you have to check for fidaxomicin. If it is not there, then vancomycin. Sir, how do I give vancomycin? For this, we give oral vancomycin. You may ask a question, sir, you told vancomycin is not absorbed orally, then why are we giving it orally? I told you, this Clostridium difficile is a local infection in the intestine. So when I give vancomycin work locally in the intestine and kill the Clostridium difficile. So that's why we give it oral. Yes. Now once we understand this, let me write the adverse effect of this vancomycin. The drug is known to produce Redman syndrome. Redman syndrome. Second problem is the drug is ototoxic. So ototoxicity. So never combine with loop diuretics because loop also cause ototoxicity. Third problem is the drugs are nephrotoxic. So obviously you have to reduce the dose in renal failure. And don't combine them with amino glycosides which are also nephrotoxic, the drug interaction. So that is about vancomycin story. Similar to that, we have other glycopeptides which have come to the market. The name of that is called teicoplanin. It is called as teicoplanin. Teicoplanin advantage is less oto or nephrotoxicity. But it is there, but it is less compared to vancomycin, teicoplanin. The second drug is, all of them end with vancin. For example, telavancin. So they have taken the name vancomycin and they have kept for other drugs except teicoplanin. The other drugs carry the same vancin. Then we have dalbavancin. Then we have voritavancin. Now voritavancin not only inhibits this transglycosylase, it also has additional inhibition of transpeptidase like penicillins. It can inhibit the enzyme transpeptidase, that is the specialty of voritavancin. Now this dalbavancin, voritavancin are longer acting. These are longer acting glycopeptides. So these are the other glycopeptide drugs what we have: teicoplanin, telavancin, dalbavancin, voritavancin, TOD. So you can remember the drugs as TOD, TOD drugs, or you can remember them as DOT drugs. So what is DOT? D for dalba, O for vorita, T for two drugs, telavancin and teicoplanin. Okay, and the clue is all of them end with vancin, vancomycin, vancin like that. Okay, sir, where do you use these drugs? Uses. So newer GPs, where do you use it? Obviously, they are effective and gram positive. So what does gram positive mean? Staph. What does staph cause? Skin and skin structure infection. So they are used to treat skin and skin structure infections. Skin and skin structure infection. You may ask a question, sir, are we giving them orally? No, they are also big in size. They are never given oral. They are given injections only, parenteral. So teicoplanin, telavancin, dalbavancin, voritavancin are given parenteral injections, not oral. They are not absorbed. Why? Bigger size. So when you know the glycopeptide, we have similarly something called lipopeptides. Now the drugs lipopeptides, their major site of action is on cell membrane. These drugs act on cell membrane. So I'll be telling you the drugs acting on cell membrane here. And in that, the first group is called lipopeptide. One more group of drug which act on cell membrane are polymyxins. So we'll be discussing two important things here, the lipopeptide and the polymyxins. Now since we also have cell membrane, their toxicity is more with these drugs. Since we don't have cell wall, we don't have so much toxicity with beta-lactams or other drugs which are affecting cell wall. But the drugs affecting cell membrane, they can also cause toxicity in us because we also have cell membrane. So let us start the journey of lipopeptide. In lipopeptide, what we have is the drug by the name daptomycin. Daptomycin. Now, daptomycin pharmacokinetics is, it is poorly absorbed orally. It is poorly absorbed when we give orally. So it is given as IV injection. It is given IV because of poor absorption. So what is the spectrum? The spectrum of activity is on gram positive only. Again, a potential question. Will it work on gram negative? Never. No. What is the mechanism of action? The site is cell membrane. The site is cell membrane. So please remember, the site is cell membrane. What does it do? Now the daptomycin, very important mechanism. Daptomycin binds to calcium. Binds the calcium. Now after binding to the calcium in the cell membrane, what does it do? It will create the pore. It create pores in the cell membrane. Not only that, it causes potassium efflux. Now when the potassium efflux occurs, there is paralysis of the DNA, protein. The DNA, protein and RNA synthesis are inhibited. RNA synthesis is inhibited. And remember, this drug is bactericidal in nature. The drug is bactericidal in nature. So this is in detail. Okay, so this is in detail. Sir, you told it acts on cell membrane. Yes, the major site of action is cell membrane, but when it creates a pore, potassium efflux occurs, DNA, protein, RNA synthesis is inhibited, so it is bactericidal drug. That is the detailed mechanism of action. Simply remember, it's a bactericidal drug acting on cell membrane. That's it. So bactericidal drug, you know the pharmacokinetics, you know the spectrum, mechanism of action. Now, when you know this, what is the use of the drug? So since it covers gram-positive only, it is used in the management of MRSA, and it is a drug of choice for what? VRSA, vancomycin resistant Staph aureus. But the drug is ineffective in pneumonia. Why? The drug is ineffective in a patient with lung infection. So let me write it as in lung infections. What is the reason why it will not work in lung infection? The reason is simple. What is that? In the lung there is surfactant. As surfactants will inactivate the drug. So you know that when we give the drug, it's absorbed, distributed. It has to come to the lung and then kill the bacteria. So when the drug enters the lung, the drug is inactivated by the surfactant. That's why we cannot treat lung infection with that. So surfactants inactivates the drug. That is, the surfactant in the drug, surfactants in the lung will inactivate the drug. So that's why it is not useful in lung infection. What is the adverse effect? The adverse effect is myopathy. So patient may complain of muscle pain, or there may be increase in the CPK levels. So the main problem is myopathy. So one of the drugs which act on cell membrane is the daptomycin. It is called as lipopeptide. So the second category of drug which act on cell membrane are called polymyxins. Polymyxins are also going to work on cell membrane. Remember, polymyxin act at cell membrane. And are they cidal or static? They are bactericidal. Do they work on gram positive or gram negative? Very important point. Please remember, they are effective for gram negative only. They don't work on gram positive. So the drug is polymyxin B. So we have polymyxin B and we have polymyxin E. Polymyxin E is also called by a name colistin. Now the problem with these two drugs are highly nephrotoxic. You may ask a question, sir, why so much of toxicity to the kidney? Because the drugs act on cell membrane and we also have cell membrane. So the toxicity is more. Highly nephrotoxic drug, highly neurotoxic drug, and they can also produce neuromuscular blockade. So the name is called polymyxin and polymyxin E. Now, because of so much of toxicity, polymyxin B is not used as systemic drug. It is used as the topical drug. So it is used topical only. So that is not used systemically. So what is used in systemic is colistin. Let me write about colistin, very, very important drug. So colistin is used systemically when it is used in resistant cases only. It's like resistant gram-negative infection only. So it's one of the reserved drug. For example, there is a war. The war is fought with bullets, not with a nuclear weapon. So it's like a nuclear weapon. We use it only in the end. So it is used in resistant gram-negative infection and resistant. One more infection which is gram-negative is Pseudomonas. It is used, and also it is used in multi-drug resistant MDR, multi-drug resistant Acinetobacter. And then it is also used in New Delhi metalloproteinase 1 producing bacteria. So it's like a reserve drug for all these infections. The name is called colistin. Why we don't use it routinely? Because highly neurotoxic, highly nephrotoxic drug. So that's why we reserve the drug for resistant gram-negative infection, multi-drug resistant Acinetobacter, and New Delhi metalloproteinase 1 producing bacteria. We use colistin. So that is about the glycopeptide, then lipopeptides and polymyxins. Okay. So remember, mainly vancomycin, drug of choice for the MRSA, but it produces ototoxicity, nephrotoxicity, and it can cause red man syndrome. Drug is not absorbed orally, but we use it orally in management of pseudomembranous colitis. Then other drugs in glycopeptides, they all end with vancin except teicoplanin, which doesn't end like that. They are also given parentally, not orally, because they are not big in size, they are not absorbed. Then we have lipopeptide, the name is called daptomycin. The major side of action is cell membrane. It is bactericidal drug, and importantly, it is used in the VRSA, drug of choice for VRSA, but it will not work in pneumonia or lung infection because the surfactant inactivates this. Major adverse effect is myopathy. Then we have drugs acting on cell membrane. One more group, polymyxins, polymyxin B, polymyxin E, also called as colistin, highly neurotoxic, nephrotoxic, and neuromuscular blockade. Polymyxin B only topical. Colistin is a reserved drug for resistant gram-negative infection, multi-drug resistant Acinetobacter, and also New Delhi metalloproteinase 1 producing bacteria. So that is the use of colistin for it. So all these drugs what I discussed, they are mainly bactericidal drug, and glycopeptides are gram-positive only, lipopeptides gram-positive only, and polymyxin gram-negative only. So this is the points you have to keep in your mind when you revise this video. Thank you all.